Thank you to the moderators, and I join the crew with my compliments for the organization to the Manos and Manos. Okay, this is my disclosure, nothing to do with this presentation that is not advancing. Okay, let's do this. Yeah. So, the topic is quite particular and in continuity of the previous presentation during the day, but with a little different perspective. The patient-reported outcome and quality of life. Of course, we are probably abusing of this surgery about the rotator cuff, and Jeffrey demonstrated this. You see that the increase is impressive, including, the switch from open to arthroscopic, even in my country, Italy, and of course all around the world. However, what is the true aim of arthroscopic rotator cuff surgery? We were discussing all the morning, and we still don't know exactly, but at least we are expecting to get tendon healing, to stop the disease, because it is a disease, as already mentioned by many others, progression. Most of the cases are disease. We want to restore the function and make the patient satisfied. These are the major targets of our job. So, I like to scratch my bald head sometimes, and since I'm a senior surgeon, I like to turn around and say, what I did for decades in my professional life was useful or not for the patient. So, since in my university I have very good students, I pick up one of those. This is his thesis now in press, and I have a very good database, and he did a study with a retrospective study of 1,000 patients with 12 to 15 years of follow-up with value-based and patient-centered study. So quite a huge number and quite a long follow-up. Of course, we had a drop-off because of the long time and so on, but still the number is very significant and the time is long. We included in this criterion study a very selected population. Single-row basic repair with metallic suture anchors. You see the data, and we excluded open, double row, transosseous, augmented, whatever. And because, of course, there can be a bias in this kind of perspective of the study. Which is the materials emitters? We didn't do any MRI, sonography, blah, 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 but a quick dash, simple shoulder test, and the overall satisfaction question. So again, a little different perspective of the job we did. Quick dash, for those who are not, let's say, expert with this, it is the quick disabilities of arm, shoulder, and hand, ranging from 0 to 111 items, questions. They can answer with different numbers, and then you may reach 0 when it is perfect, 100 when it is terrible. You cannot do anything. Simple shoulder test, 12 questions, yes and no, very easy. Black and white in your answers, but the most interesting, we asked something that is not standardized, but it is very straightforward as an opinion. If you could go back in time, would you still be willing to undergo the same procedure, or would you rather try another therapeutic approach? Because at the end, this is the target, the final target of our job, at least in my opinion. So this was the study. To describe the average patient-reported outcome between 12 and 15 years of arthroscopic rotator cuff repair, comparing results by gender and age, not only fatty infiltration or so. And you will see some influence of that. And then understand also the satisfaction and the value of an arthroscopic rotator cuff repair. These are the study participants. There is a statistical message here. You see that the age at surgery, it is 57.7, age at interview 7.2, but with a large standard deviation. This large standard deviation, I have statisticians there, they told me you cannot avoid this because the normal distribution in such a sample of population is not achievable with a shorter, smaller standard deviation, and they suggested me to watch the numbers in two ways. The mean value and the median that is giving the image of the numbers that we are seeing. So this will come back in the next slides. These are the separation of the groups according to sex, age, and at surgery. you see that male and female, we have 50% for each group roughly, a little bit less for females. And you have the 3 basic decades of the treatment. Under 50, light gray, 51 to 60, that is light green, and big green, it is over 60. And these colors will come back in the next slides again. So now let's go to the results of this. Overall quick DASH results. And you see that the mean, overall mean, 7.1, and it is the overall value. But if we go to males, females, and age, you understand that males are performing, let's say, better, because under 5, it is an excellent results in the quick DASH. Between 5 and 15, it is good. Between 15 and 35, it is fair. Over 35, it is poor. Just for somebody that is not expert with this. So you see that male are performing well, and girls and women, they are performing good, but not as well. And you see the distribution overall and related to age. As I mentioned before, we also, because of this standard deviation that is high, we moved into the median. And the median is giving us the perfect image in the percentage. And again, you see that males are performing very, very well in 66%, and women 54%. And you see overall 65%, and then you see a little difference, and it is quite understandable related to the age, before 50, 50 and 60 and plus. Let's move now into the simple shoulder test. Again, the same numbers, yes and no, very easy here to understand. You see male and female and age and the score overall and the percentage. Again, going to the bars, since the results were not normally distributed, as I explained before, we focused on the percentage of subjects with a perfect score, 100 of positive answers. And you see that males are 79, and 70 are the women, overall 79.7, and you see the distribution related to age. This is the most interesting to me after 15 years speaking with an old lady where I repaired the cuff. Were you happy or not with my repair? And the positive results are also confirming the overall satisfaction questions. So both the scoring system and the answer are really equal, let's say. You see that males are 97%. And again, I did not do the question, just my students. So they could even yelling to me, oh, Dr. Castagna was so bad, I did something, I was wasting the time. So they were free to do so, and they didn't. These are the numbers, quite impressive in a positive sense. But we should say that the gender outcome difference is also confirmed by the scoring system and the results, because for some reason, males are performing a little better than females, and again, the groups were quite homogeneous, and I don't have an explanation for this. So, let's say, can we be very happy with the results of our job? Yes, because all the patients are happy, but I don't think so, and we understood this very clearly during this beautiful morning about rotator cuff repair, because we are sometimes just pulling our lips to make us happy with some numbers, but it is not always true. Going back to the initial slide, and it was coming back, this is like a refrain of the entire morning, we are not still able to get tendon healing. We don't know about the stopping the disease progression, restoring the function. We don't know exactly where are the borders, but at least we make the patient satisfied, but we still have a long way to go. Thank you. I hope this was interesting and a little different perspective. Thank you very much.